Hi, my name is Chitra and I'm a PhD student in the Orthopedic Mechanobiology Lab at Virginia Tech. This presentation is a brief overview of my research on the use of focused ultrasound to treat chronic tendon injuries. The motivation for this project is one of the most common overuse injuries of the tendon, known as tendinopathy. It is a chronic degenerative condition in which excessive mechanical loading or overuse results in microtrauma of collagen fibers, eventually leading to tendon rupture if untreated. Histopathologic changes associated with tendinopathy include degeneration and disorganization of collagen fibers, increased cellularity, and minimal inflammation. Tendinopathies have a notoriously long recovery period compared to other overuse injuries. While the mainstays of treatment include rest, non-steroidal anti-inflammatory medication, and corticosteroid injections, little evidence exists to support the successful long-term outcomes of these treatments. Rehabilitative exercise is known to confer symptomatic relief and improve tendon function long-term. Although the biologic and structural mechanisms underlying this presumed healing response are poorly understood, it is widely agreed upon that therapeutic mechanotransduction processes promote healing of the injured tendon. Therapeutic ultrasound has shown modest preclinical efficacy in the treatment of acute tendon injuries. Typical therapeutic ultrasound in physiotherapy utilizes intensities between zero point 0.1 to 2 watts per centimeter square, thus responsible for only mild temperature elevations and acoustic pressures in tissues when used. Small improvements in tissue healing are thus likely due to local heating of tissues. Also, despite its common use, the mechanism of action and optimal acoustic parameters for therapeutic ultrasound treatment are unknown and remain to be investigated in models consistent with chronic tendinopathy. Focused ultrasound methods have shown great promise for non invasive tissue ablation, drug delivery, and stimulation of tendon healing. Compared to therapeutic ultrasound treatments used for physiotherapy, focused ultrasound typically uses much higher intensities and it induce significant bioeffects through mechanical and or thermal mechanisms. The acoustic parameters and devices used in focused ultrasound can be customized to target treatment of injured tendons with higher spatial and temporal resolution while remaining tolerable and safe for the patient. Furthermore, focused ultrasound pulsing parameters can be modulated in real time during treatment across a wide parameter space. The objective of this project was to design and construct a modular FUS system that is capable of applying well controlled pulsing schemes to murine Achilles tendons. Experimental measurements will verify the delivery of such pulsing schemes within the desired treatment volume, which is consistent with mouse Achilles tendon dimensions. The primary design considerations were the transducer frequency and focal zone. We used a custom 1 MHz transducer and verified the true focal zone using beam profile tests in a degassed water tank. The plots on the bottom show the pressure curves in the X and Y directions corresponding to tendon thickness and width, respectively. I enlarged the Z curve, which corresponds to tendon length, for a closer look. This specific curve tells us that the applied pressure will span the length of the mouse tendon, which we know to be about 6 millimeters in length. And overall, these pressure profiles are appropriate for the mouse tendon dimensions. Using this design, we plan to study thermal and mechanotransduction bioeffects of focused ultrasound and its efficacy in the treatment of murine tendinopathy. In vivo high frequency imaging and ultrasound speckle tracking of tissue displacements will be performed in the murine model to study the mechanical effects. In vivo mouse Achilles tendon temperature changes under a range of FUS treatment parameters will also be studied. Based on these outcomes, we will treat injured tendons with these protocols and rigorously assess healing using mechanical, histologic, and cell biologic outcomes. This is otherwise not possible using commercially available ultrasound systems. Please reach out with any questions. Thank you and stay safe.